Good evening, guys. I have discussion C for you. We're discussing a growing trend in America with elderly folks um, living living alone um, with needing care. So we're going to discuss that for tonight's C. So please join me for the presentation I made. Here we go. More older Americans are growing older or growing old alone, but who will care for them? Growing trend of solo aging. Over 16 million Americans age 65 now live alone, up dramatically from the 1950s. This shift is driven by longer lifespans, higher divorce rates, childless, and geographic um, dispositions of families, health and social vulnerabilities. Nearly 40% of solo seniors face face challenging or face challenges like cognitive decline. Sensory impairments or difficulty with daily tasks. These issues heighten risks of isolation, depression, neglect, and premature hospitalizations or death. Real life stories. Seniors like Jerry Norrington and Mary Felder exemplify the struggles to maintain independence while close uh, lacking close kin or caregiver support. Their experiences underscore the urgent question: who will care for the millions aging alone? Would you like to explore culturally responsive models or community based frameworks that could address this? Caregiving gap. I'd love to co design something with you that bridges policy, practice, and lived experience, especially given your deep commitment to equity, infrastructure, and culturally responsive care. Solo aging demands both systematic innovation and personal planning. Here's a synthesis of promising solutions across individual, community, and policy levels. Individual level strategies, empowerment through planning, advanced directives and POAs, legal tools like healthcare proxies and financial power of attorneys ensure wishes are honored. Solo aging plans. Use checklists like the life plan assessment to map out housing transportation, care, preferences, and emergency contacts. Personal care advocates. Services like Solo Aging Solutions offer trained healthcare agents who can act as surrogates and care coordinators. Community based approaches, building connection and support. Village models, member driven networks, e.g., Beacon Hill Village, offer transportation, social events, and vetted service providers. Co-housing and shared living. Uh, Intentional communities where older adults live together, share resources, and reduce isolation. Faith and cultural institutions, churches, mosques, and cultural centers can serve as hubs for outreach, caregiving, and integrational engagement. Policy and systems level innovations, scaling, equity, and access. Public guardian Public guardianship programs for those without family. Some states offer legal guardianship services, but these need expansion and oversight. Medicaid funded HCBS, home and community based services, can support solo agers with personal care, meals, and home modifications. Give me 1 second. Caregiver cooperatives, worker owned models that provide culturally competent care while offering stable employment. Culturally responsive and participatory models tailored for marginalized solo agers. Digital toolkit and myth busting resources. Co designed materials that address stigma, cognitive health, and aging myths. Life review and legacy projects. Prompts and programs that honor lived experience, especially for rural and BIPOC elders. Community health navigators, trained peers who help solo agers access services and advocate for care and build trust. Would you like to co-create a modular framework or toolkit that integrates these strategies for specific populations, say rural African American elders or LGBTQ solo agers? I can help map stockholders, build evaluation matrix, and draft implementation guidelines. You're asking the right question. Tracking an aging plan is essential for solo agers, especially when you're juggling infrastructure gaps, cultural adaptations, and care coordination. Here's a curated set of tools and frameworks we can help that can help you monitor, update, and evaluate your aging plan over time. Comprehensive planning and tracking tools. Navigating Solo Workbook. A 140-page planning system tailored for solo agers. Includes step-by-step guidance across 7 core domains: legal, financial, housing, health, social, support, legacy, and emergency planning. Features dozens of worksheets, checklists, and templates to move from ideas to action. Ideal for building and tracking a personalized plan at your own pace. Aging Solo Planner by Lona Senior Services. A modular handbook for reflection, questions, worksheets, and tracking templates. Covers aging in place, healthcare decisions, social networks, and end of life planning. Designed for solo agers to assess progress and identify gaps. Planning for One Roadmap for Solo Agers. Created by Zigmund CFP. This guide offers financial and long-term care planning strategies. Includes tools for tracking estate planning, housing options, and support networks, especially useful for childless or unmarried adults. Digital modular tracking ideas. Google Sheets or Airtable templates. Create a personalized dashboard to track legal documents or care contacts, housing preferences, and emergency plans. Trello or notation boards. Use cards or pages to organize tasks, deadlines, and reflections across domains like health, housing, and legacy. Solo Ager Timeline. Build a virtual roadmap with milestones, e.g., update advance directives, explore co-housing options, review care manager contacts. Would you like help designing a culturally responsive tracking template, maybe one that integrates myth busting prompts, infrastructure mapping, and community engagement matrix. I can help build it out with modular sections and evaluation criteria tailored for your work. There are several mobile apps that can help you track, manage your aging plan, especially if you are aging solo and want to stay organized, safe, and connected. Here's a created list of apps that align with your holistic, equity driven approach. Okay, guys, so that is C for you. I might jump back on later for D. Do not know yet, so I will see if I can do a D later. For now, Gator Wellness, take care, folks.